Ma'am, it is used to describe a noun.
Yes, yes. It is used to describe a noun. Very good. So, according to Matarazzo, psychology is the noun that identifies the subject matter, health psychology, or setting in which psychology is applied. Like other fields of psychology, health psychology applies now. Health psychology will apply the principles of psychology to health. Health psychology does not exist as a profession separate from generic psychology. Rather, it applies both research knowledge and clinical experience to the science and profession of generic psychology. So it is going to include both your theoretical and both your applied knowledge of psychology in the field of health. Health psychology has clearly emerged as a unique profession. To become a health psychologist, all the 6 criteria needs to be met. Health psychology is a unique profession because it has met all the 6 criteria. Now, the first criteria is it has founded its own national and international association. Then it has established, now there are a lot of journals of health psychology where you can do research work in the area of health and you can publish it in this journals. It has received acknowledgement from professionals in other fields of psychology that its subject matter, methods and applications are different from theirs. Now they have their own independent, professional body. Fourth, health psychology has set up postdoctoral training. If you want to do your postdoc after your PhD, you can do it in health psychology. It has received recognition from American Board of Professional Psychology. And sixth, it has been recognized as by the American Psychological Association Commission and on the recognition of specialties and proficiencies in professional psychology. In addition, health psychology is becoming recognized within medical schools. Now in medical schools also there is a health psychologist. Schools of public health, universities, like in our university only, there is a paper which you are studying now. In hospitals, health psychology strives to enhance health. Again, it's a repetition. Prevent and treat disease, identifying the risk factors, improve the healthcare system, and shape public opinion regarding health issues. Then we are going to discuss about the area of special focus of health psychology. What are the areas on which health psychology lays its focus? I think today we will cover up this and we will wind up, okay? Health psychology is concerned with all aspects of health and illness across the lifespan of individuals. Across the lifespan means it covers the age group from the time you're born to the time you are dead. Okay, health psychologists focus on health promotion and maintenance, how to lead a healthy life, how to maintain staying healthy, which includes such issues as how to get children to develop good health habits. How can you inculcate good habits in your children? How to promote regular exercise, and how to design a media campaign to get people to improve their diets. You can arrange, a health psychologist can go for some, awareness campaign, can set up some community center areas in rural places where they can educate the people on, the diet. Health psychologists also study the psychological aspects of the prevention and treatment of illness. A health psychologist might teach people in a high stress occupation. Now you see people, corporates who are working. They have many people, not only corporates, businessmen, then they are in a very high, stress prone occupation. Every time they are always, in a very competitive world. And there are many ups and downs. So these are the people who are at the site of being affected. A health psychologist might work with people who are already ill and help them adjust more successfully to their illness. A health psychologist can work with a patient who is diabetic, can help him to maintain a proper lifestyle, will help him to maintain the proper treatment regimen. Treatment regimen means the treatment program which is being designed by your physician and which you have to follow strictly, taking medicines on time, practicing yoga, then doing meditation. Okay, there will be a diet chart. Health psychologists also focus on the etiology. Etiology means causes and correlations of health. What causes, say, cancer? That is the etiology. And what are the risk factors that can lead to cancer, like high carcinogenic food, okay, food which have a high carcinogenic component, like hamburgers, then tandoori food and all. Even deep refrigerated foods are also carcinogenic, which are very, very cancer prone. Then taking alcohol, taking cigarettes, all this can lead, gutka, tobacco, all this can lead to, all these are very high correlates of cancer. So health psychologists will focus on the causes of cancer, will help to identify the risk factors which are highly correlated with cancer, illness and dysfunction. Already it is explained, etiology. Now I'm not going to discuss this. Finally, health psychologists analyze and attempt to improve the healthcare system and the formulation of health policy. It will try to monitor the present healthcare system. If everything is okay with the healthcare system, if something is lacking, what more can be added, what more can be done to improve the healthcare system, what more health policies needs to be formulated. They have an important role to play in this area also. They study the impact of health institutions and health professionals on people's behavior and develop recommendations for improving healthcare. They will also take a proper decision regarding the psychology, the built-in environment of the hospital or of the doctor chambers, improve patient-doctor communication, and so on. Putting it all together, health psychology represents the educational, scientific, and professional. This is again the definition which is given by Matarazzo, which is being already explained to you all. Now, students, regarding your attendance, please do me a favor. According to your roll numbers, please keep telling me who all are present. Students, you can unmute. Students, are you all there?
Yes, ma'am.
In the chat box, kindly we have 15 participants. So excluding me, it is 14. 14 of you are present in the chat box. Kindly write your roll numbers and name so that I can mark you present. Please do the needful. Please write your roll number also, huh? Please do it fast.
Oh, Durga. Heavy. More to my face to go see the Garnier light. Garnier light to the. I do Divaso. Oh, clean to. Eh? Mukot go, Mukot.
Lucy, what is your roll number? Lucy, what is your roll number?
14, ma'am, 14.
Oh, man. I was very good for a
Rinky, can you please spell out your roll number? Rinky?
Ma'am, roll number 8. Ma'am, roll number 8.
Okay. Then Sharing Dicky Bhutia. What is your roll number?
13.
Okay.
Oh, they are my dear. Oh, the dear. Download.
Okay, thank you, students. I'm sharing this material with you all in the group, okay? You all can go through, and in our next class, if there is any doubt, get back. Thank you, everyone.
Thank you, ma'am.
Ma'am.